Hello, my name is Zoltán MASSAY-KOSUBEK. I am public health advocate at the European Public Health Alliance, and I am now here with my colleague Chris, who will put forward 7 questions about the impact of TTIP on health. We are talking about international treaties and legal text. Therefore, it is important to have legal insurance that will be definitely the case, and public services will be out of the scope of TTIP. We have recently seen the joint statement of Mr. Froman and Commissioner Malmström, but the statement is not clear about the exclusion of public services, including healthcare services, from the TTIP. Therefore, it is vital that we have access to the negotiation text, because that can prove really the real intention of negotiators, and that could then give the necessary insurance for us, for European citizens, that our healthcare services will be well protected. Both TTIP and the free trade agreements have the potential to threat our health systems, because they can lead to higher privatization. Looking at the evidence, there is no proof that privatization of healthcare services lead to better health outcomes, to better treatment of patients. Therefore, we have to be very careful with free trade agreements, and we have to make sure that they don't lead to privatization of services. Normal citizens and patients would feel immediately the negative impact of healthcare services included in free trade agreements via 2 ways. First, the quality of services. Free trade agreements could lead a liberalization of healthcare services, which could then lower the quality of the provided service, so then that would be an immediate impact on the average citizen. Secondly, the price. Privatization aims to maximize profit gains, and again, in order to realize higher profits, then services could be more expensive for citizens. ISDS can be the tool within the corporation to sue governments and to force them to privatize their healthcare system, or to prevent them to reverse that decision if that was already made. Of course, ISDS cannot directly bind governments, it cannot have a direct legal obligation, but indirectly it can put a huge pressure on government because of the huge costs every ISDS case requires. Let's just mention the recent Achmea versus Slovakia case, where the subject of that ISDS procedure was exactly the privatization of healthcare systems in Slovakia. And although in that case the Slovakian state won, it still prevented them to do normal actions because of the huge time and resources involved in that case.
Now,
it is important to note that the regulation of professional qualifications, both in the US and in EU, belongs to the member states' competence. However, including those regulations to the scope of the TTIP could lead an increased flow of healthcare workforces between the 2 continents, and it has a real danger. Look at the situation in Europe right now. There is already a huge inequality between the 2 sides of Europe. Doctors and nurses are leaving Eastern European countries, which threatens then the healthcare system sustainability in those countries, and we do not want to have our doctors and nurses leaving Europe and putting in danger the whole European healthcare system in every country. I am afraid so that TTIP will have a major impact of the price of human medicines. TTIP has the potential to extend the patent of certain human medicines, which would mean then the cheaper medicines, the so-called generics, will be not available during the extended patent time, which will then make simply the human medicines more expensive for ordinary citizens. public procurement is a priority area for the European Commission because including public procurement into the TTIP would allow European companies to have access to the US market. However, from our side, we are very much worried about the health impacts of public procurement. As you know, public procurement is very relevant for the healthcare sector. Healthcare service providers, such as hospitals, use the European public procurement procedures to secure their needs for example, medical devices and other essential tools. Therefore, it is essential that the public needs will dominate the public procurement procedure and not the profit interest and the private needs. So, that's why we have to be very careful about public procurement, and we urge the negotiators to pay particular attention to the healthcare impacts of public procurement.